Hello, students. A very good morning to all of you, and welcome to this class, which is starting about the topic on professionalism and ethics. So, I usually like to start a class with a quote. So, today's quote is: "You may not be able to control every situation and its outcome, but you can control your attitude and how you deal with it." So this quote is also a small uh, idea into what the today's topic is. It's all related about the attitude. So a very good morning once again. Let's start off with the topic, professionalism and ethics. I'm Dr. Swati Tikare, a professor in physiology department, and let's get off with the topic of today. So the objectives for today's class is about the concept of professionalism and ethics. At the end of the class, each one of you should be able to explain the concept of professionalism and ethics among healthcare professionals, and secondly, able to discuss the consequences of unprofessional and unethical behavior. So professionalism and ethics is a very vast topic, but we are going to give you just a little introduction about this in this fundamental foundation course. Okay, so what is the spec doing here? A tailor at the boutique or something is trying to take certain measurements. What I want to tell with this picture is, if we want to get an outfit ready for ourselves, maybe for a wedding, for a function, something like that, there is so much that we want. We want that the person should be able to guide us about what the current trends are, should be able to guide us about the type of cloth we should buy, how much we should buy, from where we should be able to buy. And once we give that, we want it to be stitched very well, and in the fitting should be good, and so on and so forth. And he should be timely, he should listen to all our things, and so many things. So with just a small thing as our outfit, we are so very particular how it has to be. So we expect certain behavior, a professional behavior from that person. So if we are expecting in small things, whether it's our dress, whether it's our hair, uh, whether it's a photo that we want to be clicked, in so many things we are expecting a lot of uh, uh, particular things which the person should be able to do. So definitely when we are entering into a profession like medicine, also people and the society expect certain qualities in us. So that is what guides us or tells us what professionalism and ethics is about. Okay, so that was a short way of telling you uh, what professionalism means, not in terms of medical professionalism, but the word professionalism itself. I hope you have understood what it means and how important it is for every profession. Okay, so let's now go about what is it, why is it essential, and how are we going to learn professionalism, and if we do not, what are the consequences? So coming back to the professionalism as it concerns with a health professional, let's try to see what it means. So you might have understood now that professionalism is nothing but a set of attributes or character or behaviors that defines the particular profession. Okay, in our case, it is about the doctor. Okay, I'm trying to give a very casual definition right now for you to understand. Later on, I'll be giving you the proper definition. Okay, so professionalism just means a way in which the person, which a person or a doctor has to behave and what is expected out of it. Okay, so let's just see what are these uh, attributes that defines a doctor. So the first and foremost, if it was a live class, definitely I would have wanted to know from you people what you think are the attributes of a doctor. Since that's not possible, let me just pause for a minute for you to think here. What makes a good doctor? Your own experiences of having met a doctor or taking one of your relatives to a doctor. What did you feel? And what made you happy or unhappy about that person's behavior? Please give it a thought for a minute, uh, how you felt and what were the good and bad things which you thought was there in the behavior. I'm sure you're trying to getting a flood of reflection and memories of so many good and bad things that have happened. Moving on, uh, I have just put three things here which we think is important for a doctor. Doctor has to be learned. He has to be updated with the new knowledge. He should be skillful, whether it's for a surgery, whether it is to do the clinical examination or to give the injection or so many things. But apart from this knowledge, when we talk of knowledge, it is about what we use the word cognitive domain is related to knowledge. When we talk of skills, skill is performing something through our hands. That is called as the psychomotor domain. So all these days, we are either learning something, gaining knowledge, that is in the cognitive domain, or we are doing something with our hands. Maybe in the practicals, you have done something, you learn something. So that is more important here. We learn so many skills. So that it is related to the psychomotor. But apart from this cognitive and psychomotor domain, we have understood there is something more important which adds to the character of being a doctor. So what is that? That list is endless and long. Okay. So what is it? We expect that the doctor should be honest, forthcoming. He should not hide something with us. He should be open to us. He should be impartial. He cannot spend 10 minutes with the patient beside us and just come and hurry up with us. We would not like such a thing. We expect the person should be polite, kind. The person should be approachable, interactive. Means we should be able to tell what our problems are. And he should not be somewhere up the pedestal where we cannot talk to him at all. He should be a good listener. He should be a good communicator. He should have good communication skills with him. He should be disciplined. He should be coming on time. He should be doing certain things in a proper way. We don't like people doing haphazard things, especially not the doctor. He should show concern to our problems. So he should be concerned. He should give respect and not talk just very rudely or something like that. And he should be responsive. I have just listed a very few. Responsive means he should respond to our concerns. Okay. Yes, it's okay. It's okay. If that kind of a thing he tells when you are bringing out your problems, that is not something we like. So this list, or what you can see on the right side, is totally related to, these are the attributes or these are the attitudinal behaviors, attitudes and behaviors, which are so much more important or as much important as the knowledge, as the skills of a doctor. So in this particular session, we will be learning more about the attitudinal aspects and the communication aspects and all these things which are important in being a good doctor. So now let's try to define professionalism in a more systematic way. So professionalism, or in the terms of the medical term, medical profession, the professionalism is the habitual and judicious. These two words are very important. What we are telling, habitual, that means he is on time. It cannot be once in a blue moon. It has to be habitual. The person is kind or concerned or talks softly, communicates well. All this cannot be once in a while. It has to be habitual. And when we use the word judicious, judicious means some things, some attributes have to be used in some context only. Like the person can make the patient feel little better by using some humor, but it cannot be used always. It cannot be used in very serious condition when the patient is. So we use the word judicious. So some things have to be habitual and some have to be judiciously used. So what are those attributes? So they are the communication, knowledge, his technical skills, clinical reasoning, the emotions, the values, and reflection. All these things, they are certain new terminologies for you, but whatever we told, at least if you can recall the previous attributes, all his attributes he has to use habitually and judicially in daily practice for the benefit of the individual and community being served. So if the person is able to do this, then we would say that this doctor is really professional. Okay, so it has to be used on a daily basis for the benefit of the individual and the community being served. This is a small picture trying to show what are all the aspects which involves professionalism. Let's begin with here. Caring, compassion, openness, respect for patient's dignity. Here, it would be quite theoretical, but I think if you can recall just any doctor-patient relationship which you had, and you would try to reflect upon it, then you will be able to understand this better. Means you are now, you have not been on the, being a doctor, you have not been a doctor, but you have been on the other side. And this is all what the things you expected. Now, these are the only things that you are expected from you right now to be getting inculcating. So what are this? Caring, compassion, insightful and self-aware. That means take responsibility for whatever your action is. Be committed. Act in the best interest of the patient. Maintain confidentiality. That means whatever has been revealed by the patient to you as a doctor cannot be spoken of lightly in a gathering and reveal the information to all and sundry. Okay, altruism, unselfishly you are going to treat the patient only thinking what is best for him. Okay, that is altruism. All these attributes of professionalism in one more class we'll be dealing with in more greater detail in the next class. Okay, now just try to understand what all are the things which makes the person, the doctor, feel professional. Integrity and honesty are important. Morality and ethics in dealing with patients, caregivers, colleagues, and also society is expected. Responsibility to society. Use one's expertise for public good and be accountable. Be responsible to the profession. Maintain integrity, morality, and conjugal relationships with the others. And to be accountable to one's own conduct. Teamwork is very important in this profession. We should work respectfully with other medical experts in the best interest of the patient. When we have all these attributes, we could say that the person is competent or really professional. So this is just an introduction to the behavior of a good professional physician or a doctor. Let's just see a few examples of this professional or unprofessional behavior in the form of cartoons to understand a little better. Okay, so what does it say here? There is this patient here and there is a doctor here, and probably these are some junior colleagues. Okay, a little professionalism, people. When asking a patient to undress, we do not giggle. Okay, so it's quite self-explanatory. We need to be sensitive towards the needs and feelings of the patients. This is not the time where you are in one class and in the first year you will not be able to learn everything about the professionalism and how to become a great doctor or all those things, but we are just trying to make you sensitize you towards being professional. Okay, so this is another picture. Here is a doctor who is examining a patient with an otoscope, his ear, and we can see a lot of characters around, and all these characters are probably medical students or uh, colleagues. And see this. Do you think the patient would be comfortable? Oh, hey guys, check this out. So this is the noise that is being created here in this situation. So would you call this professional? Absolutely no, right? You would all agree that this is not a professional behavior. So here you see a female patient and a male doctor, uh, and she doesn't seem to be so very comfortable. What is he saying? So, what do you say? We discussed these test results over dinner. So, Doctors Without Borders. I hope you have heard about this. Doctors Without Borders is a good idea. Doctors Without Boundaries, not a good idea. So, it is not professional to behave with a female patient in an uncomfortable manner. So this is one more cartoon. Would you again call this professional? There's a patient who is lying very uncomfortable, just trying to probably take a bit of sleep. And at the same time, there is a nurse and there is a doctor who are trying to discuss something very casually and talking about something. So I've tried to just put some pictures which are able to show the unprofessional nature. Whereas here you can see how even though the patient may be in pain, was in pain, how the doctor has probably put him into a comfortable situation and position, and he is trying to, the feelings always when you are in a scenario has to mimic or to relate to the other person, to the patient. You can't be having other feelings. When the patient is in pain, we can't be showing a very happy mood. So these are all some small, very tiny examples where a little bit of consciousness and awareness can make you very respectful when you behave in a certain way. Okay, so coming back to some more theoretical things. So professionalism is a term which embodies the numerous qualities of a physician as public servants. Okay, so this is one more way of defining it. Another way would be constituting those attitudes and behaviors that serve to maintain patient interest above physician self-interest. You don't have to by heart all these definitions. Definitely know what you need to do is to learn what are the do's and don'ts. Okay, so coming to medical ethics. Now, this term medical ethics itself is new for you. So, what do we mean by medical ethics? You have learned a little bit about professionalism. Now, let's see what is medical ethics. Anywhere, ethics is like a moral principles on which we make some decisions. Okay, so here, when you tell medical ethics, we mean a combination of moral principles and values that are applied to take judgments. Okay, so whenever we are to take some decisions, we should have some principles based on which we will take the decisions. Okay, like if you want to tell whether you want to go with your friend to a particular birthday party or no, then you will take the decision based on your own moral principles, what your culture is, what your parents feel about it, what you yourself think about it, how your upbringing is. So based on all this, we take certain judgments, right? In our routine life. So similarly, in medical profession, there are so many judgments to be taken in practice during research. Okay, so or during all these times, there are certain principles. We will learn about what are those principles. Okay. So based on those principles and moral values, we make some decisions. So this is what is called as medical ethics. Okay. Let me read this line once more. A combination of moral principles and values that are applied to take judgments in medical education, in medical practice, and in medical research are termed as medical ethics. Let me just give you a few let me tell the principles of ethics first, then we will go to the examples. So there are four pillars or principles of ethics. What does it say? The first one says the principle of non-maleficence. Okay, what does that say? That means first thing is do no harm to the patient. Forget doing good. If you don't do good also it is okay, but don't do anything that will harm the patient, like prescribing something wrong, sending the person to a wrong consultant, doing something wrong which is not beneficial. Don't do any harm. That is the first principle. The second principle is the principle of beneficence. That means do everything possible which will benefit the patient, not benefit the doctor, not benefit the hospital, not benefit the research project that you are doing, but that is for that which is most beneficial to the patient is what is to be done. The principle of beneficence. Thirdly, respect for autonomy. So autonomy, as you know, means the person himself takes responsibility, or he is capable of taking his own decisions. So here when we use the word autonomy, we mean patient autonomy. That means no matter what you think something, a person comes with some pain abdomen, you think that he's having appendicitis, that the immediate surgery is what is the best thing to be done, but you cannot do it unless the patient gives the consent. So autonomy means the decision lies with the patient. You can only tell that these are the options and this is the best option that I think. Okay, but choosing the option is left to the patient. Respect for patient autonomy. Okay, regardless of what you think is the best, we as a doctor can only say that it is the best, but the decision is left to the patient. Lastly, is last principle of the ethics is the principle of justice. So what do we mean by justice is equitable uh, service to each and every patient. Okay, regardless of the caste, the gender, or the patient is in special ward, the patient is in general ward, or some only few ICU beds are available. Who gets the ICU bed? Who does not get? This principle of justice was so much put to test, especially during this recent COVID times, where doctors were forced to take a decision about who will get the bed, who will get the ICU bed, who will not get the bed. So these are very, very difficult ethical dilemmas. We will try to give you some, I'll try to give you some examples where this ethical dilemma, though we want to do the best, we want to do no harm, but still we are constrained sometimes by the situations that we will be in so much difficulty to make a decision. We want to do the best, but still there are dilemmas where we are going to face. So let's see the things. So ethics is a system of moral principles and a branch of philosophy which defines what is good for individuals and society in general. So we know, and that is what is applied in the sense of medical ethics. Let us me just give a few examples. Ethics related to patient-physician relationship. You were just seeing one cartoon where the male doctor was not behaving very well with the female physician. So how there is a lot of ethics that has to be followed. Where do you stand? How much do you speak? How much do you reveal? So a lot of things are related in the ethics related to patient-physician relationship, ethics related to human research. So this also was quite obvious when you all have heard during the COVID-19 times when a quick vaccine was to be released. How much can we put the subjects on risk and how much we cannot? So how to take risk, how to take the calculated risk. So these are all the ethics related to human research. It's not just about the vaccine. Any new treatment which has to come out has to pass through four stages of clinical trials. Stage 1, 2, 3, 4. First one is, that is the human trials after the animal trials. So I'll not go into those details, but there are so many ethical difficulties. There are those related to artificial reproduction, where the donor is there, the donor of the ovum, donor of the semen, and what things can be, for how long they can be kept and how long it cannot be kept and whom it can be revealed. All these are related to the ethics. Ethics related to dying patient. So when to remove the life support and whose consent has to be taken for that. So many things related to that. Ethics related to organ donation and transplant. So we have these, though we know our intent is right, it's not always very easy to take those decisions. So slowly, and you will, these are very complicated things which I have told you, the dilemmas. But in the beginning, following the four principles of ethics is what is more important at this point of time. Just remember those things whenever you are seeing any patient. So now, why we need to know or learn about professionalism? Why are we so much bothered? Because medicine is a profession and physician is a professional. I profess means I promise. So it's unlike every profession, we mean to say when we use the word profess that I promise to do something. So that's how it becomes important. And morally, we are bound to be ethical, to be professional. And apart from being morally bounded, we are also bound by legal laws. Okay, so there are a set of principles or conduct which has been given by the Medical Council of India. Now, instead of the Medical Council of India, we have the National Medical Council, that is NMC, that is governing our medical education and the medical profession. But initially, this NMC has come only 1 year ago, but before that, it was the Medical Council of India. Okay, so what was those regulations? The law governing the professional misconduct by doctors is governed by this law, Professional Conduct, Etiquette, and Ethics Regulations, given or which was updated in 2002. This governs the regulation of every registered medical professional. Okay, it gives a list of do's, list of regulations, a list of things which a person has to do and which should not be done. I am trying to list out very few of them here for you, just so that you get an idea. What are the expectations out of the doctor? So it is very essential that every medical professional registers with the competent authorities. Okay, so once the medical course is over, there is the medical council into which the person has to register. If there is a specialization, there is another registration. If the person opens a clinic, there is a registration at the DHO. If the doctor opens a hospital, then again there is a registration at the DHO, and so many things. Okay, so every registration, whichever is mandated, has to be done. Then the the doctor is obligated to provide a standard care. The doctor cannot provide any advertisements. He has to maintain patient confidentiality, maintenance of medical records, display the registration numbers. You need not remember all of them, but just you have to have an idea what are all these. Employ or delegate work only to qualified persons. Okay, in a hospital or in a clinic, if the person is employing someone, the person should be a really qualified and should be a registered individual to whom the person is giving the delegating the work. Use generic names of medicine. Do you remember whenever the doctor writes the brand name and we take it and then we tell, okay, if the content is same, it's okay, you have another brand, please give. So now that's the reason why the government has made it that we write the generic name of the medicines mandatorily. No secret remedies should be offered. Prenatal sex determination cannot be done. Taking patient's consent is obligatory. So these are very few, very few things out of the long list that is there in the conduct and duties of the doctor, just to give a glimpse or idea about what the doctor uh, needs to do as a professional. Okay, so what will happen if a doctor does not follow these? Consequences of professional misconduct or unethical behavior. Okay, I will not dwell into it to very detail because we, as students, as first year students, you don't even know what your duties are right now. You have to just practice them, know them first, and afterwards comes not doing them. Okay, but I'm just, since it is part of this course, you should know that if you don't follow them, what is going to be happening. So it can be broadly categorized into three things. There can be a criminal liability, there can be a civil liability, or a disciplinary action. Okay, so what is this? I'll start from below because that is the most lowest thing. Disciplinary action means it is action taken either by the hospital itself or the college, medical college, or from the registration authority to remove your name or to give you notice and all such things. Okay, then the civil liability is about, okay, they can put some fine on the uh, doctor for not doing some duties. So that would be a civil liability. Criminal liability is one where, due to some doctor's negligence or something, there is a very untoward incident happening to the patient, the patient becoming very grievously affected, or the patient dies, then there can be a criminal liability. Not that all the treatment will result in, every treatment cannot be successful. We know that, okay? But the doctor has to exercise certain standard care. If he fails to give that standard care, and that is the reason for the death of the patient, then it can lead to a criminal liability. That means we are, as a doctor, they are morally bound. Let's not go too much into this, but just it was part of the uh, objective that was given under the foundation course. I have tried to put this in. So cases of professional misconduct, ultimately we should not go to this level where the person a doctor gets a notice or something like that. Okay, so there can be medical negligence, there can be misconduct, and there can be legal cases against the doctors. Let's not go into the negative things. Let's see how you are all budding professionals right now. You are more interested in knowing how can we become very good doctors, not just doctors. So to become a doctor, you have to pass all the exams, you have to become complete all the course, but how to become very good doctors? So how do we inculcate professionalism? How students learn professional values? So it's not that all of these professional values which were told is not there within you already. So most of you are already honest, most of you are already disciplined. So some values are already there within you as core values. Okay, so you bring with you those core values, those important values with you already. Okay, so upon that you will build it up little more. So some are learned in the formal curriculum. like this one. So here, this is a formal curriculum where we are telling you, okay, you need to be honest, you need to be disciplined, you need to be a good communicator, you need to be a good listener. So we are trying to tell these are the things. This is the formal curriculum. So most of it is but learned from the role models. So when you actually come to the medical school, then you go to the hospital, and when you are looking how the doctors are interacting with the patients, that is when you make them your role models. You learn by seeing them. So most of these professional values are learned in terms of following the role models. So what's this penguin doing here? It's doing just what I'm doing right now, lecturing. And now this is the penguin in action. It is actually showing you how to do. So that's the observation. All are so keenly observing, right? The previous ones are like not so interested. They're just looking at how much, but see this, every eyeball is open and trying to see. So this is how we actually learn, by seeing others. So tips to learn professionalism. First thing is observation. Be a keen observer always. Anything and everything you observe is important. Okay. Second thing is following the role models. Last and most important thing is you observe, you see the role models, but the most important thing is you introspect on it, you reflect on it, about all the knowledge, all the attitudes, all the behaviors that you saw. You introspect what was good, what was wrong, what could have been corrected in this interaction, what way in which the doctor whom you saw, the consultant whom you saw was talking, how was the person talking, how was the bodily posture, how were they interacting. All these things, not only you observe, but you also introspect and reflect upon it, what was good and what was bad about it, and what you need to do about it. Okay, so these are all the ways in which you can start inculcating the professionalism into yourself in the student life itself. So one of them is by assuming the behavioral codes. Okay, so it starts with the dressing. You can't expect a cricketer may be dressed in an casual clothes, but do you think we would respect a person who is wearing slippers and casually dressed in the wards of a hospital? Definitely no. So it all begins with the your mannerisms, your dressing, your attitudes. So you can start off with all this right away as students. So the schedule that you do, follow the discipline, the hand hygiene, then become a self-learner. This the personal development. It's not that something is being taught, we are testing you, then you learn, then we again ask you. So this is not going to happen, especially in the case of professionalism. Become a self-learner. Be aware, self-awareness. Inquire into your own competence. How good am I? How was I yesterday? How much better I have become today? Emotional awareness. Do I really relate to the patient's emotions properly? Do I have the confidence to talk with them? So make this self-awareness, self-regulation. So the whole thing about professionalism is what you do. This is not something which will be evaluated. It's not something which will be checked what you're doing properly and not doing properly. Okay, in between, if you do a drastic mistake, maybe somebody will notice. But it is a uh, lifelong goal to become better and better. And it's the journey starts now as a first year student to reach out to that professional behavior that is very the epitome of grace and happiness for the patients, uh, to reach to that stage. Okay, you start your journey now. So ultimately, I would like to tell a small take-home message of the entire class would be just a few lines. So you have all understood that medicine is a noble profession. The profession demands expertise in not only cognitive, that means knowledge, psychomotor, that means skills, but also in attitudinal and communication domains. Okay, what matters to the patient is not only how much you know, how well you can do the operation, but how well you talk to them, how well you behave with them, how much respect you give them, how much love and concern you show towards them is very, very important. Medical education and profession is guided by principles of professionalism and code of ethics. We are morally and legally bound by this. The doctor is morally and legally bound by the written and conventional. Means all these attributes which we are telling, it is not written anywhere. They are the unwritten rules. So we are bound by the written as well as written where those rules which were written by the MCI, what I told, certain rules are there. So those rules are there. But the behavioral aspects are not written. They are the conventional code of conduct. We are bound by them also. So last, but the most important, medical students must inculcate these professional values beginning from their student days itself. Okay, so this is the time where you start inculcating these values and have an urge to make it better and better with each passing day until there is nothing called the perfect. You have to overcome even the perfect. You can become better than that. Okay, it is always chance for improvement and you keep improving yourself, but at least the minimum standards have to be achieved by the end of your medical education is complete. So thank you so much. I hope you have not got bored and you have enjoyed this session into the professionalism and medical ethics. We will have another session on professionalism and medical ethics in the coming days. Thank you, one and all. And while leaving, I would like to tell this quote: the patient will never care how much you know until they know how much you care. So be that caring doctor which every patient would like to go to. So thank you.